Picture this, a seemingly ordinary flu season turning into a nightmare for families, with more children facing severe illness or even death as vaccination rates drop dramatically. That's the heart-wrenching reality we're confronting right now, according to the latest reports from the Centers for Disease Control and Prevention, CDC. But here's where it gets controversial. Is the flu vaccine really the shield we think it is? Or are there deeper issues at play? Let's dive in and unpack this together, step by step, so everyone can grasp the full picture. Christine Ware's voice cracks with emotion when she discusses the approaching flu season. We're all on edge, she shares. We're figuring out how to live normally without isolating ourselves completely. Her 4-year-old son, Beckett, is still on the mend from a flu infection he caught back in January. Just a week after falling ill, he became profoundly exhausted and immobile. He couldn't lift his head, move his arms, eat, or speak. Ware, a 40-year-old from River Forest, Illinois, recognized the signs immediately. It was the second bout of a serious inflammatory brain condition triggered by the flu, known as acute necrotizing encephalopathy, or ANE. For beginners, ANE is a rare but terrifying complication where the flu virus causes severe swelling and damage in the brain, often leading to long-term neurological issues. You can learn more about it here. https://www.nbcnews.com/health-news acute necrotizing encephalopathy, brain swelling. This latest episode has been tougher on Beckett. His brain is taking much longer to bounce back to its lively state, Ware explains. Interestingly, the first diagnosis came in September 2022 when he hadn't received his annual flu shot yet. But the second time, he had been vaccinated. Experts note that vaccines might not offer the same protection for those who've already experienced flu-related brain inflammation, which raises questions about long-term immunity. And this is the part most people miss. Why does this happen, and what does it mean for future prevention? Incidents of pediatric ANE and similar flu-induced brain disorders are climbing. In the 2024-25 flu season, the CDC's new data recorded 109 children with this uncommon complication. Of those with known vaccination records, a staggering 84% hadn't been vaccinated against the flu. This backdrop includes the nation's record-high 280 pediatric flu fatalities last year /www.cdc.gov/fluview/week37.html, surpassing all except the 2009-10 H1N1 pandemic, alongside a noticeable decline in childhood flu vaccination coverage. We can't always foresee which children will suffer the worst flu outcomes, which is exactly why we urge vaccination for all, explains Dr. Buddy Creech, a pediatric infectious disease specialist at Vanderbilt University Medical Center in Nashville, Tennessee. It's a common misconception that only frail kids face these risks. The flu can strike anyone severely. ANE is indeed uncommon, with just a few cases annually, and hasn't been systematically monitored until now. Yet, this season, healthcare providers have observed a noticeable surge in children battling brain inflammation post-flu. I can't confirm the exact numbers, but from my experience treating these kids, it felt like a definite rise, says Dr. Molly Wilson-Murphy, a pediatric neurologist at Boston Children's Hospital and a contributor to the CDC study. Being hands-on with patients really highlighted this trend. Let's break down the perilous complications of the flu. The 109 children in the study all had influenza-associated encephalopathy, or IAE. Where the virus invades the nervous system, symptoms vary widely. Kids might experience confusion, trouble walking, hallucinations, unusual movements, or seizures. Dr. Wilson-Murphy believes there could be at least 7 subtypes of IAE. ANE, like Beckett's condition, represents roughly 1/3 of these cases. Among children with IAE, 74% needed intensive care unit admission, 54% required ventilator support, 55% were otherwise healthy beforehand, 19% tragically passed away. Flu poses a genuine threat to kids everywhere, no exaggeration, emphasizes Dr. Keith Van Haren, a co-author of the study and pediatric neurologist at Stanford Medicine in Palo Alto, California. It's not an overstatement. Now, on to the declining childhood flu vaccine rates. Annual flu shots aren't perfect at preventing infections, unlike stronger vaccines such as the measles, mumps, rubella, MMR1, but doctors stress their value in minimizing severe outcomes and fatalities. As parents and physicians, our aim is to safeguard children's health and shield vulnerable ones from worsening conditions, Van Haren notes. Flu vaccination stands out as the most straightforward and effective strategy. Last season, the vaccine proved up to 78% effective in preventing hospitalizations among kids and teens with the flu. Around 90% of the 280 deceased children hadn't been vaccinated. The top defense for you and your loved ones against influenza is universal vaccination, advises Dr. Sean O'Leary, an infectious diseases expert from the American Academy of Pediatrics. Early insights from the Southern Hemisphere's flu season reveal the vaccine having flu-related hospital stays. Yet flu shot uptake among children has dipped in recent years. CDC figures show only 49.2% of kids received their shot last year, a drop from 62.4% in the 2019-20 season. O'Leary points out that the reasons are multifaceted. Growing vaccine skepticism. https://www.nbcnews.com/health/news/data investigation. Childhood vaccination rates are backsliding. US/RCNA22876 plays a role, but so do barriers like limited healthcare access. Many families struggle with getting care, and clinics often face staffing shortages, making it hard to run extended flu shot events after hours or on weekends, he adds. With few exceptions, the CDC recommends https://www.nbcnews.com/health/health-news/data investigation childhood vaccination rates /www.cdc.gov/flu/2025-2026.html annual flu vaccination for everyone aged 6 months and up. For at-risk children like Beckett, it's crucial that society as a whole steps up, as his mother Christine urges. It's tempting to dismiss the worry when it hasn't hit your own family, she says. But getting vaccinated is a straightforward, effortless step to safeguard my boy. This situation sparks heated debates. Is vaccine hesitancy driven by misinformation, or are there valid concerns about efficacy and side effects? And what about the counterpoint that natural immunity from past infections might offer better protection than vaccines? Do you agree that declining rates are a public health crisis, or is there another way to tackle this? Share your thoughts in the comments. Let's discuss and learn from each other. Erica Edwards. www.nbcnews.com/author/Erica Edwards NCPN 56261. Erica Edwards is a dedicated health and medical news writer and reporter for NBC News and Today.